My pharmacy sits inside of a comprehensive cancer center, and we are really integrated into the healthcare team.
I am into a year worth of ongoing chemo treatment. I was diagnosed with breast cancer back in 07 or 08. And then I had a 5-year reprieve, and they found that it had metastasized. Long story short, here I sit, almost 12 years into it.
I was diagnosed in 2015. I continued to work up until a couple of years ago. Having cancer, I try really hard not to let that define what I do. I'm very active in my community.
We're trying to have a child. It was only a few months into that process that we found out that we were pregnant. So every 2 weeks, I was getting this blood work done. And it was showing some weird trends. The moment that the hematologist saw all these weird trends, he says, I need to admit you right now for a bone marrow biopsy. That night after the bone marrow biopsy, a doctor came into our room. She said, I'm sorry to be the one to tell you, but you have leukemia.
The gastroenterologist steps up to my bedside and he says, Derek, we found a tumor in your intestines about the size of a grapefruit. We had it biopsied while you were under, and we have to tell you that you have non-Hodgkin's lymphoma.
Thank you for sharing. I am blown away and inspired by all of your stories. For your experience, what was it like with your care team?
It's like a family.
God blessed me with a huge care team. Not only the medications that were being given, but also how to pay for those medications. The special programs that are out there that they are aware of that help patients with medications, because I needed that when I, was unable to work as a nurse.
I've been so fortunate to have such a fantastic team of healthcare professionals surrounding me. At every step of the way, I was on 50 plus medications a day at extremely high dosages, having the alarm reminders on my phone, and then having the email reminders and the text reminders that I got from my pharmacy saying it's time to refill your prescription. Are you on target? Not doing what they need to do for their medications. When people start cutting themselves off from the outside world and stop going out to dinner with their friends, or they stop getting outside and seeing the sun, they start to close off their world, and the world becomes what is immediately surrounding them.
I think that's a key piece of moving forward and ensuring the long-term survival of our patients is having that mental wellness check-in.
Have I gone to those dark places? Oh, most definitely. But I also realized that when I got to that place, that I needed somebody to talk to and sought out someone to talk to. Mental health is important. Isolation is really horrible for us.
Do you ever feel that people treat you differently?
I was in the grocery store struggling, and I was still real low energy, and I was kind of struggling to get through, and I guess a gentleman saw that. And by the time I was ready to check out, he presented me with a bouquet of flowers and touched me so much that, of course, I start bawling happy tears.
I have to go through this. I don't want to look like I'm sick. However, it was really empowering the night that my husband and I shaved our heads.
Maybe share a little piece of advice or maybe uplifting note that you would like to send off.
Joy is not really based on your circumstances. Happiness is. Joy is an intrinsic thing, but God just restored my joy, and it doesn't matter what my circumstances are, live and enjoy.
There's one thing that you can't ever take from anyone, and it's hope.